I'm not so, I need to identify today I'm in a comfortable zone or not. So that discomfort, that slightest discomfort which one starts feeling about self, about their surroundings, or about just their being, that is important identification. That's an important warning sign which each one of us have to identify. Like, we appreciate those parents because it's very difficult for the parent to understand that my child needs psychiatric or psychological help and they're getting. So I think somewhere it is like certain people are trying to end it in their generation. So it's not going to life also is good, because what happens when we are to ourselves, we start seeing only negative in our life. But when we see others, we understand, okay, no, I mean, my life is better than that person's life, so I'm okay, I'm good. I shouldn't be cribbing all the time. So it's important for us to be in touch with the social environment.
We have heard enough and we have read enough as to how to take care of our physical health issues. However, not many of us are confident enough to speak about our mental health. In our today's episode, we are going to talk to Dr. Akshata Amunkar. She's a psychiatrist practicing in Goa and has helped many to recover their depression and mental health issues. I'm sure you will like today's episode and leave your suggestions and comments. I will be waiting for that. Hi, this is Aljira Pereira from Era Inspirations, and I welcome you in today's episode. Dr. Akshata, I'm very happy to have you on the podcast of Era Inspirations, and I would like you to introduce yourself to our audience before I could ask you more questions.
Hi, I'm Dr. Akshada, and I practice in Goa. I'm a consultant psychiatrist. I've been practicing in private since last 4 years. I've worked in government before that, and yes, I do see different types of cases in psychiatry, and I do deal with all types of disorders in psychiatry. So I would like to take any questions today which you all have. Probably I'll try to answer whatever is there.
First of all, what is the difference between psychiatrist and psychologist?
Okay. So psychiatrist is someone who has studied medicine, who has done MBBS and has done a degree in psychiatry. Psychologist would be someone who has done clinical psychology, like BSc, MSc psychology, or MPhil. So these two are separate things. We both do deal with counseling sessions, and we do counseling, but psychologists mostly are only with counseling. Psychiatrists are with prescription of medication, and we prescribe medications. So psychologists do not prescribe medication; we prescribe medications. And when there's hardcore counseling services required, we do refer the cases to psychologist. So that's the difference, that we prescribe medication as psychiatrists. Psychologists do counseling sessions.
Mm-hmm. Okay. And how have you seen the evolution of mental health over these past recent years?
Since when I started my career in psychiatry, yes, there have been a lot of changes. Uh, Stigma is reducing for sure, okay, which was really very high before. It is reducing. Many young individuals are coming up to take help, like for sleep disturbances or for anything like the smallest thing like stress, anxiety. Especially after COVID, I have seen a number of cases rising in anxiety and depression. The lockdown has affected people in a way that the whole social distancing and isolation has affected people. There are a number of cases coming up with this suddenly out of the blue anxiety. Cases have worsened. I mean, the cases have increased in number, and they are coming up for help. So this is what I positively feel as stigma is going down, which is a good thing.
Mm-hmm, mm-hmm. Okay. So, how does one recognize that he or she is suffering from a mental health issues? Like, how does
Uh,
one identify himself?
so this is something which a person has to be really aware of, what he or she wants or what he or she is, and what is the identity basically. Like how I was 10 years back, and today if I'm not so, I need to identify today I'm in a comfortable zone or not. So that discomfort, that slightest discomfort which one starts feeling about self, about their surroundings, or about just their being, That's important identification. That's an important warning sign which each one of us have to identify. Like, for example, if I'm able to see, I was able to see, like, suppose you say 10 patients 3 months back, and today suddenly I feel I'm not even able to see 4 patients. I get drained, I get tired. Something is wrong, right? This is not me. If I was comfortably seeing 10, 3 months back, and today I'm not able to see four also properly, and I'm very frustrated, irritated, drained out, that means something is going wrong. Either I'm burnt out, or either I'm having some other stress, I'm not sleeping well, something is wrong. So I need to understand. So I need to identify myself that what work I would do with that motivation or determination, I'm not able to do anymore. So that is something which each one of us has to be aware of, and we have to acknowledge and identify that and not be in denial about it.
Mm-hmm. Like many other health issues which has actual symptoms, are there any specific symptoms that we should identify in ourselves in case of mental health?
Of course, so you have to see that if your, the nature which you have, or your behavior has changed or not. I mean, there's a sudden change in your behavior, or there are certain sleep disturbances coming in. The sleep pattern has changed, or your eating habits have changed. Things which were making you feel pleasurable before are not anymore giving you pleasure. You're not feeling happy about things, or you start having weird thoughts about people around you. You start being a little suspicious. You start getting odd thoughts in your mind, repetitive thoughts, negative thoughts. So basically what I'm saying is that anything which is going, like, diverting from your normal self, anything for that matter, you have to
Mm-hmm.
identify and tell yourself that yes, something is going wrong with me. I need to see someone. So I think the first thing what you have to do is not directly go to a doctor. Just see if you're going to talk to someone in your family. Identify that one person in your family whom you can talk to, or ask, do you find a change in me? I'm finding something odd about me. Do you find a change in my behavior? See if that person also validates that. Ask, if not in the family, see if your friends are finding it. Sometimes it's so that we don't come to know, but someone else is noticing and telling us that something has gone wrong. Why are you behaving this day, like, this way these days? So there's something wrong, please seek help. So many a times it's not the patient feeling that, but some friend, someone notices and they tell, hey Papa, you need to see someone because you are looking very stressed out these days. So that is something, when someone says that, please don't be in denial. Please don't be in any kind of, don't take it negatively. Take it positively and go ahead and seek help.
Mm-hmm. Yes, this is the very important point that you have raised, that if somebody is concerned about you, only then that person will say that there is some
Yes.
issues with your behavior.
And I would
So
say
the
trust that
question
concerned
is,
person. Hmm.
yeah, that's right. So I have observed this. I have come across a couple of cases where there are sudden change of behaviors in that particular person. However, whenever that person is approached to even speak politely, he takes it negatively or blame us. You think I am mental, or you think I am out of my mind. These are the words that we normally get to hear. So how does we as a healthy person address this issue with that particular disturbed person?
Uh, I think first thing is you'll have to see to it that you speak to that person in isolation, not when there are other people around. So,
Yeah, that's a
example,
good
he's
point.
your very close friend, or he or she the sibling. See to it that there are not no other people around where it become like a chaotic situation or a very dramatic situation. You'll have to talk to that person one on one. Start with a conversation like, look, I wanted to speak out something, but I do not know if it's going to hurt you. Please take it positively. It's a very good intention. I just don't want it to worsen further, so I'm trying to talk to you. So start with that first. See what is the reaction. Okay, when the
Mm-hmm.
reaction comes from that side, say, you can stop me anytime you want me to stop, but I want to speak it out because it's been troubling me also for some few days, because I think this can help you. Then I think slowly
Mm-hmm.
you take it in that person's favor, so that person feels like taking it all, what exactly is being discussed or what is exactly being spoken about. And then slowly setting the conversation that you are not a person this way, but something else is happening these days. Have you felt anything like that? Do you also feel something is going wrong? If needed, I can help you. We are there. Okay, other friends are there. I'm there. We can do it together. So just ask for help. So I mean, it has to start with a very good empathy, sympathy, and then you start speaking, and the patient will get talking.
That's right. So what I have observed is that in Indian families mostly, this kind of conversations doesn't take place. Normally, we are not that. Do we? I mean, we do stay close to each other. We stay in the same house, but we are mentally and emotionally quite far away. If you understand me correctly, how to start such kind of sensitive
Yeah.
conversations?
So, so now at first I always speak about this intergenerational psychiatry. I mean, every generation, no, in our Indian setup, there's a lot of
Yeah.
intergenerational things which get passed on. Like a proper,
Mm-hmm.
if one father was strict, the next generation father also will be like, my father has done this, I'm going to do this. It will
Yeah.
just go on for different generations. Somewhere someone has to stop it. So I'm saying one good change is that this generation wants to change it. So I get many of the parents getting the children to us, which is really good, and I really appreciate those parents because it's very difficult for the parent to understand that my child needs psychiatric or psychological help, and they're getting. So I think somewhere it is like certain people are trying to end it in their generation, so it's not going to follow further, right? So I think that's the only thing, that if you identify some of your trait of your generations has been wrong, identify that and try to change it. I'm not saying completely take it out and throw. Something might be really good out of that also, but modulate it in a way that it suits your current needs and the trends. So that is
Mm-hmm.
very important for us to understand that yes, we were not having discussions as a family before, like maybe some years back it was not happening, but currently yes, because the parents have also become aware of parenting and a
Yeah.
lot of family therapy and a lot of family discussions. Yes, people are talking, voicing out, and children are voicing out and saying that, I feel unheard, you please hear me out, you talk to me. So there have been children, adolescents especially, who come to us and say that I want to talk to my parents, but they don't have time. So after therapy and after talking to them, yes, they've started doing that. Slowly they have started talking to their parents and they started understanding. So there's a patient of mine who's a transgender. So he had a difficulty, getting a sex change done, but he had a difficulty communicating it to the parents. Because obviously they wouldn't understand. They're from a very, they're from a village background. But slowly he communicated one on one. He went and met them, told them what exactly is happening with him. It's not something which I'm suffering from or something. It's the way I am. And after 1 year of or 6 or 7 months of talking to them and actually letting them understand what he feels, they actually have accepted, and now they are buying him dresses, clothes, jewelry. So it is a very, very good way of accepting. So he has broken that. I mean, I'm just telling you, okay, we can actually start communicating. Communication can start. I'm
Mhm.
sure the
That's
parents will
right.
not tell the child to stop. So the children also, as children, we have to start the communication.
Mm-hmm. Agree that. And what I realized is that first we have to accept ourselves, and only then
Yes.
you will be able to explain to others what we feel.
Yeah. Accept ourselves, see the right and wrong. Simply don't go
Mhm.
and fight with the parents saying they are wrong always. Obviously, they are not wrong all the time, but certain things, if you feel are not correct, not matching with your current trend and generation, you try to ask
Mhm.
them to change. Or you at least understand that you have to modulate around them. So there's no chaos in the house.
Mhm. Absolutely true. So they say that we are what we eat. So does eating habits affect our mental health?
Yes, they do, because a lot of nutrients which are there, like carbohydrates, especially when they are low or they go low on the amounts, it can make you feel a little low on energy. Hypoglycemia can set in. It can make you feel a little depressed. Also, you can get palpitation because of hypoglycemia. So yes, it does affect. Eating does affect the mood, because you also must have seen that whenever we eat something nice and sweet and sugary, we feel happy, right? We
That's right.
eat good
Yeah.
food and we are happy. So yes, food releases those happy hormones, and food is important. So it's very important for us to eat in moderation with proper monitoring.
Mhm.
But yes, I believe in that. Believe that food makes people happy.
That's right. So, over the years, I have seen that there is a lot of awareness about the mental health. And how do you think the schools play a role in getting people being aware about mental health issues?
So there's a lot of campaigns which are going on. and schools are participating in that. Programs are held in the school, the rural health. The government also is holding a lot of programs through
Mm-hmm.
which they are spreading awareness about suicide prevention, then mental health issues, addiction problems in the students. So all these things are happening now, and I think we are in a good position that the children, and we are getting cases even of 13 and 14-year-old teens where they come up with anxiety issues. So which is good in one way that they're coming up with a problem. But I just that I don't want it to become a fad that yes, I need to go to a psychiatrist and I need to get checked. That also had started happening that I need to see a therapist. But awareness is happening. We need to do more in this field. We need to really tell them how to screen and how to identify. So next step I think which the government should take, or someone should take it up, is that the teachers are sensitized about mental health illnesses in all the schools. Most of the schools are having now all the childhood issues, all the adulthood issues, adolescence issues. This should be sensitization should be done in the teachers.
Mm-hmm. And what steps does one should take to avoid getting into a mental health issues in order to keep himself healthy?
Good sleep, 7 to 8 hours sleep, good hydration, good food. Okay, keeping yourself away from stress, seeing
Mm-hmm.
to that you do at least one exercise, you do some 1 hour of something, yoga, meditation, or you say gymming, or you go for just jogging. Do some exercise. Keep a hobby for yourself. Okay, hobbies are very important because if you have that, that's the only thing which saves you from the stressful situation of yours. Like people like gardening, people like stitching, knitting. So these are hobbies which have kept them up. In the past, if you see, all the women had some hobbies, and that would keep them away from depression and anxiety. Because in their time when they were free, they would do this crochet and knitting. They used to make this tablecloths. They used to do a lot of things. They used to make those papads and the summer vacation. They used to
Pickle,
go to
yeah.
yeah, pickles and everything. So this is to keep them happy and completely busy with things.
Mm-hmm.
Now we are not into all of that. We are buying everything ready made. We have got so
Mm-hmm.
much time on our hands that we sit and scroll our mobile phone. So it what is happening is we are having a lot of free time to think of all negative things around us. So I think hobby is very, very important. So I'm just stressing on hobby. And yes, I think I've covered all of them. Other than that, I think it's important that we talk to at least one friend of ours, not every day, then at least once in a week, see to that you meet or talk to your that close friend so that you keep in touch, that you feel that yes, someone is there for you. And whatever you're like, whatever you like, keep doing that. That's very important. And whenever you feel stressed, you have to talk it out. That's the most important thing. Keeping it inside will not really help. So these are few things which you have to keep doing to keep yourself away from a mental health illness.
Mm-hmm. That's right. So this also reflects that the lifestyle also affect the mental health. That means if you have a good lifestyle of exercise, good eating habits, a time for yourself, then you are able to keep your mental health in place.
Yes.
This is what it means, as I understand. Mm-hmm. That's right. So, how has the media or digital industry or social media has influenced the mental health positively and negatively?
Positively, it is creating awareness. Okay,
Mm-hmm.
yes, awareness is being created. People are coming up to us and talking to us. Negatively, it is creating fads. It
Mm-hmm.
is creating communities where people feel that they have some mental illness and they join the communities and they become part of certain communities and they just be in that. I mean, even if they don't have something, they'll feel that they have something.
Yeah.
Example I'll give you is ADHD because this is something which is going on. Some of them really genuinely have the ADHD, but some of them start feeling that they have all the symptoms which are there in ADHD and they come to us for screening.
Mm-hmm.
Okay, and that is become like a fad. So I think positive is that awareness is increasing. Negative is that fads are being, I mean, there are groups and communities being formed which are not really required. I think
Mm-hmm.
whenever someone is having a mental health issue, they should seek help from a professional and not be a part of such communities which might not give all the knowledge which is not which is available.
Mm-hmm. Right. You mentioned about ADHD. Can you tell us in one or two sentences what it is, just for audience to relate
It
it?
is attention deficit hyperactivity disorder. So in that, what
Mm-hmm.
happens is that a person is, I mean, it's mostly in childhood we see, but it can get passed on to the adulthood. Nowadays, a lot of adults are coming with it. I feel it's because of screen exposure also, a lot of screen time also, a lot of
Mm-hmm.
inattention coming in us, and a lot of procrastination and fidgetiness and impulsiveness. So this is something where a person is not able to focus on one thing for a longer time. The concentration gets affected. The attention is not very good. This hyperactive mind basically. So it's like it's like no, it's a motor which is not stopping. It's like there are a lot of thoughts
Mm-hmm.
going on, like very
Mm-hmm.
overwhelming for the person who has it.
Mm-hmm. That's
That is
right.
ADHD.
Mhm. So, also very important question: is mental health related to only women? Is it gender biased?
Both of them can get it. Okay.
Like, mm,
There's nothing like women can have or men can have. Both of them can get it. Only thing is that certain things are more prevalent in males, certain are more prevalent in females. But that also depending on the situations. But I think both are very much both can get any mental health disorder.
mhm. I have seen that a lot of men also go through this, but they are not very outspoken or expressive as women are about this kind of. Yes, of course, not many women are also talking about it, but men are even lesser. So, is there any?
I don't think so, yeah, because in my practice, I think males also coming and females also coming.
Mhm.
Both have been
That's good.
coming equally. Yeah, so there's no change I'm seeing over here, which is a good sign. Males also coming with depression, anxiety, females also coming with those complaints. So I think it's
Mhm.
good, fair enough over here. I mean, the gender wise, it's okay.
Mhm. Mhm.
At least in
That's
Goa, it's good. Maybe some village background which you're speaking about, probably there the stigma still prevails. So I don't think they seek anyone for such professional help.
That's right. So, is there any specific age for the mental issues to prevail to start? Or,
It can happen at any age.
Mhm.
Okay, we have got youngest patients also of depression, OCD, around 8 and 9 years old also. Okay, and it can be in the old age also. So there's no age for it. We do have certain age groups where certain disorders can happen at certain age groups, but now anything can happen at any age. So best is to live a very stress-free life.
Mhm.
Some things are hereditary and some things are due to chemicals and the neurotransmitters we call it. That we cannot just stop, but I think we can try and moderate
Mhm.
things around.
Mhm. And would you like to share some success stories?
Yeah, there's so many. Meaning the anxiety ones and the depression cases, they do really well. There are OCD cases who do well. We do see some schizophrenia cases over here. When I was in government, there were a lot of schizophrenia cases coming.
Mm.
Schizophrenia is something which is got a thought disorder. Over here in our private practice, yes, I do see some cases, but not many. Many of them are depression and anxiety. Many of them
Mhm.
have gone off the medication also. So another thing I would like to clear over here is that yes, psychiatric medicines do have side effects. Every medicine has side effects, for that matter. Not only the medicine of psychiatry, but the myth that we'll get used to it and it'll go on for life, it's not true. Some disorders, yes, we have to continue it for some good time. Okay, that would be psychosis or schizophrenia, but the problems like depression, anxiety, the medicines can go off, and many of my patients have gone on the medications also. So that again, I tell the patient that it's not only on the doctor or on the medication, but patient also has to put in efforts. 50% if it is coming from the doctor or the medications, 50% has to come from the patient. Once you start feeling better, you have to get into that kind of time. You have to make a timetable, schedule, and do things what are required for yourself. So that is important. So success story which happens is not only at a doctor's end, the patient also has to feel successful. That is very important.
Mhm. That's right. That's right. So, once if somebody is identified with mental health issues and recovered completely, are there any possibilities of going through the same again after certain years?
It can happen, but you can prevent it. Okay, now certain disorders like bipolar disorders, schizophrenia, yes, you can relapse. You can have your episodes, or like whenever the things can go worse. But
Mm,
if it's stress induced, I mean the situation based stress induced anxiety or depression, yes, it can go off if the situation has improved. So whenever
mm,
I tell my patients that if it is a situation based, like someone has lost a job and hence feeling depressed, the moment they get a job, they're completely fine. They're
mm,
okay. Right? So
mm,
it's that way. So if it's situation based, it can get cured forever. But if it is hereditary or endogenous meaning it is in the genes and it's coming internally, then
mm,
in that case, yes, it may come back, but we know it, so we can prevent it by doing our things.
mm, mm. And just before I could wrap up, the last question: how has stress influenced mental health? There are good stress hormones as well as there are bad stress hormones, as far as I understand.
I mean, stress, see, stress itself is not, I mean, some stress is required for all of us.
Mm,
Okay, some stress is required for all of us, but a lot of stress is not good for all of us, right?
mm,
So,
mm,
stress is something which is causing the mental health issues, obviously. Some stress, which is the positive stress, which we say, that makes us feel motivated to do something.
that's right.
Till then, the stress is good when it is not affecting your physical symptoms or it is not getting onto your nerves when you see. Some stress is really good when you have a project work which is you have to do. That little stress is required for you to get the wheel rolling and you go and get it done. But the moment it goes beyond a point when you start feeling that you can't function at all and it's just giving you nervous breakdown, that's when the stress has to be treated. And if you
Mm,
just talk it out at least. So that is
mm,
a thing. Good stresses which makes you feel motivated to work. Bad stresses which is stopping you from work.
mm,
Simple.
mm,
So that is the most important thing you have to remember. The moment you feel that the stress is not making me work, like, we all get stressed during exams. But some of us, in that stress, we just finish reading so many things. But some of us, in that stress, we just sit like that and say, I cannot do anything. I'm not able to
yeah.
focus. I'm not just able to read my book. So there are two different people, two different stress holders, you can see. So this is something which we have to identify and we have to acknowledge and address.
That's right. And any key message you would like to give to our audience?
Key message. First thing is I always tell my patients that you have to identify in this world where it's difficult to communicate with your loved ones every day. And because of WhatsApp, I think we have gone so far that it's just one birthday message and just a hi, hello, which happens on WhatsApp, and we feel connected, which actually is not true. Making one phone call to that relative of yours who you feel like just talking to, some aunt, uncle, cousin, whoever you've not spoken to for years together but have just been on contact with WhatsApp. You feel like
Mm,
just reliving your childhood memories, do it. When the moment that feeling comes to your mind, please do it. Because that itself gives release of certain happy hormones which will make you feel happy that, oh my, today I spoke to my auntie after so long. It feels so good. It feels that okay, there's someone. Right? That is one thing. Make it a habit to talk to one friend at least in a week. Okay, that one close friend, so that you can vent out and you can just be in touch with that person and know what's going on in your life and their life, so that you know that your life also is not bad, your life also is good. Because what happens when we are to ourselves, we start seeing only negative in our life. But when we see others, we understand, okay, no, I mean, my life is better than that person's life. So I'm okay, I'm good. I shouldn't be cribbing all the time. So it's important for us to be in touch with the social environment. Second thing, sleep is the most important thing. I completely stress on sleep because I feel these days, because of this binge watching and the OTT, the sleep has gone for a toss, and younger generation is having sleep problems, which is really bad. It shouldn't be happening that 20 and 25-year-olds come to us for prescription of sleep tablet when they actually
mhm.
can sleep with the melatonin which is being secreted, right? So
Yeah.
something we have to do about our sleep time. Watch OTT, watch a web series, but keep a proper time which is not in a, it's not interfering with the sleep time, right? So that is something with 7 to 8 hours of sleep is very, very important. Eating well on time, okay, this is important, and exercise. This is four things which I want to give like a key message, that these things if you do, I think your mental health will be balanced, you will feel good. So I think that's about it about the mental health. Any other questions, please ask me.
Yes, certainly. I will leave your website link to our audience so that they can get in touch with you directly and ask their personal questions. And I really appreciate you for being with us today and sharing your knowledge and information. And of course, it has enlightened us to a great extent.
Thank you so much. Thank you so much for having me. Thank you.
Thank you.
Okay, thank you.